So this case is a 33-year-old female with a horizontal cleavage tear that's pretty chronic, causing her persistent symptoms. And there's that flap to the inferior lamina that's folded posteriorly behind the tibia, and then this large horizontal cleavage tear that goes all the way through the body. So the Soterix Nova stitch is used to sneak into the back of the knee and sneak out by extending the lower jaw, passing the stitch from lower jaw to upper jaw, retracting the lower jaw, and then pulling out. So this allows me to place the stitch directly behind the meniscus, and then I tie it around the apex in this case because the horizontal tear comes close to the apex. And I'll place multiple sutures, and I'll do so until I can't get a probe into any area of tearing. So there's no gapping, and I have anatomical compression of the peripheral, central, and middle zones of this tear. 5 months later, a vision scope needle arthroscopy is performed, and it looks good. She's pain-free and doing well. You can see that the sutures synovialize and the knots embed into the meniscus. In these younger patients, it reforms an apex around these sutures on these horizontal cleavage tears. You can also see, I'll swing over to the body area here, and you can see a nice stitch there, and there's no chondral damage anywhere surrounding these sutures.